I'm going to do a talk on COVID-19 today, specifically regarding the vaccines and the boosters. So that's why you're seeing the little pun there of getting suited and boosted. Boosted is not a real word, but we're here to have fun. Before I get into the vaccines and stuff, I just always like doing a review. This is just a great slide to show the different symptoms. Some of them overlap between COVID and the flu, especially. And as many of you know, COVID is the short term of coronavirus. It's a respiratory virus that also has like fever symptoms, chill symptoms that are constitutional, as well as gastrointestinal symptoms, which is just stomach symptoms. And most people don't associate stomach symptoms with COVID, such as diarrhea, nausea, vomiting, but those do happen. So if you look on the furthest right, you can see the list of all the COVID-19 symptoms that are possible. Then in the middle is the flu, and more on the left in blue are just common cold symptoms versus influenza symptoms, and then COVID-19 symptoms. Aside from the acute or short-term symptoms of COVID, we do have individuals who are experiencing long COVID, and this long COVID may be after somebody has been diagnosed with an initial infection. They still might have any of the following symptoms for weeks, months, or even years after the initial COVID diagnosis. So this can include coughing or breathing problems, loss of smell or change in taste, body aches, headaches, chest pain or stomach pain, trouble sleeping, brain fog, fever, fatigue, and mood changes. And we don't yet fully understand these like long-term like inflammatory effects that are causing long COVID, but it is similar to the mechanisms of autoimmune disease or other types of inflammatory conditions. We don't know the exact reason for why we get long COVID. It's still being studied, but people do tend to get these very persistent symptoms. Now we've talked about the short-term symptoms of COVID and as well as the long-term symptoms of COVID. I'll review how COVID is spread. Again, if you look furthest on the left, someone either talks, coughs, or sneezes and projects these like particles towards somebody who gets the landing of the particles in the T zone. If it lands in the eyes, nose, or mouth, again, the T zone. And if you inhale said respiratory particles that are traveling in the air, you are more likely to get COVID, especially if you are not vaccinated. COVID doesn't only transmit through the air, it can also stay on contaminated surfaces, which is my individual on the far right. Depending on the surface, the COVID particles can last anywhere from 3 hours to 7 days, especially if the surface is not sterilized with alcohol-based product. Most people start having symptoms 5 to 7 days after they've been exposed, and small and enclosed spaces are highest at risk, including school buildings, office buildings, public transportations, or nursing homes. So it's important, especially if you share a bathroom, taking steps to avoid contaminating areas. Be clean, be hygienic. Let's say, unfortunately, someone does get COVID. Depending on the severity, typically it's symptomatic treatment, meaning you treat the symptoms as they come. People have a risk of getting dehydrated because they don't want to eat as much. So encouraging hydration with water, repletion, fluids, soups are very good as well. Tylenol, if you have a fever is a temperature greater than 100.4. Ibuprofen if you have body aches. Steam showers are very helpful with decongestion. Vapor rub or Tiger Balm also very helpful with decongestion. Again, notice how I'm saying you're treating symptoms because eventually the virus will run its course. However, if the virus does progress, some folks might unfortunately get a pneumonia or a sinus infection. And a viral pneumonia can even progress to a bacterial pneumonia. And in those cases, we do prescribe antibiotics. In more severe cases, some people might require oxygen or antiviral medications. The approved antiviral medications for COVID are Paxlovid, Remdesivir, or depending on your state or country, Molnupiravir. It really depends on how many days that you've been sick that determines whether or not you get the antiviral medication. But that's if you do get COVID, those are your treatment options. But what can we do to prevent getting COVID? Masking has been so important because, again, you're preventing the respiratory particle from landing in your T-zone, inhaling it, and infecting yourself. Hand washing for at least 20 seconds. Remember how I was talking about hygiene, so that in case you touch a contaminated surface, and then in case you touch your eyes, you touch your nose, you touch your T-zone, if you wash your hands or keep your hands clean, you're preventing those particles from getting into your T-zone. And of course, last but not least, vaccination, which is going to be my main portion of the talk today after all this review. COVID is actually actually a bit on the rise, given the fact that we're in respiratory season. A couple months ago, we were going down in terms of new cases, which is what we want to see. We want less and less cases in the day, so we want the graph to go down. If you notice in this graph, we are actually going a bit more up. And this can happen again in respiratory season because remember how I said the most likely places to get it are enclosed areas. And because it's the colder season, people are more huddled against each other. So that increases the likelihood of people swapping viruses and germs. I think this is a good explanation for why the rates are going up. I just wanted to give a visual to folks that despite us being so many years out, and obviously the severity of COVID has significantly decreased and outcomes are so much better compared to when we first started in this pandemic, and we are no longer, thankfully, in a pandemic. But just to show you that COVID is still around, it's now a respiratory virus that we, I guess, are going to be seeing on and off. This is just showing number of people being hospitalized because of COVID. You can see an uptick. Again, the previous slide was just showing how many new cases are coming about, but then this slide is specifically showing how many people are being hospitalized for COVID. And again, vaccination helps prevent likelihood of being hospitalized. Last but not least, I had to show that unfortunately people are still dying from COVID. Again, much less severe than earlier in the pandemic, and we are no longer in a pandemic. But I do want to stress that COVID is still around. People are still getting hospitalized, and people are even unfortunately still dying. And the folks that we see who are dying are people who are in more high-risk populations including younger children, people with lung disease, people with cardiovascular disease, people with HIV, people with diabetes, people with cancers. Just wanted to show that COVID is around, but we are equipped to handle it, and we've been doing much better compared to the past. I wanted to go over the different ways that we test for COVID. There are different ways. You can do a throat culture, nasal swab culture. There's even a way for COVID to be tested in stool. The CDC folks, they're actually monitoring COVID in our sewage systems, and they're analyzing the trends of the virus in wastewater. And researchers are able to monitor the changes in infection rates and potentially predict outbreaks. And they take the samples from these sewage systems and are monitoring the changes in the strains. And it's based on the strain or the type or the mutation of COVID virus that they see. That's how they create the next vaccine. And that's why we have so many boosters upcoming. It's because these viruses are very intelligent. They swap ideas with each other. They get smarter and try and overcome the obstacles and barriers that we put in place, such as the vaccines. This is why vaccines are being updated, because just as human beings get smarter, these viruses also get smarter. And the point of monitoring the different strains is to be able to create new vaccines. You may have heard of the flirt variants, the JN variants, the KN variants. We have developed new vaccines against these strains, and the vaccines that are on the market are against the most dominant or the strains that are most likely to make more people sick. I wanted to show different types of vaccines that we have available. I'll start with the left. A lot of people are familiar with the Moderna and the Pfizer BioNTech. These are RNA type vaccines, but one has to undergo 2 doses of those vaccines as the primary series. There's also a vaccine called Novavax, and that's protein based, and that one also needs 2 doses. I'll get again into the differences between the RNA vaccines and the protein based vaccines. But again, I just want to remind our folks that the Moderna and the Pfizer ones have been updated to help us be more protected against the newer variants like the flirt variants. And the Novavax vaccine is based on the JN1 variant, which was very prevalent in 2024. The best time to get vaccinated is late August, early September in preparation for respiratory season, which lasts from October to the end of March. But please know you can get the vaccine at any time, either at your clinician's office or your local pharmacy, depending on availability. What are some side effects of getting the vaccine? A pain or soreness can occur at the injection site because if you think about it, it's a needle causing like breakdown of skin. You might have some soreness, joint pain, fatigue, maybe a slight fever right at 100.4 or like a little bit below 100, 100.3. It's just your body triggering its own immune response to defend itself due to the nature of how the vaccine gives our bodies immunity. Some people might also experience nausea. Now, on the right, I wanted to highlight the different ages that one can get the Moderna or the Pfizer vaccines. If you see on the topmost, you can start as young as 6 months and get your first dose and then follow up accordingly to get your next set of doses. There's folks ages 5 to 11 can also get the series, and folks 12 years and up also get the series. So again, I just want to showcase that different ages, starting from as young as 6 months, can get the Pfizer vaccine. Same thing for the Moderna. Start as young as 6 months, and then you follow the schedule accordingly. But this is really just my PSA to say, please get vaccinated. I'll talk more about why vaccination is important, but just really wanted to showcase that we have different options, and then we can start vaccination as well as the booster series as able. And again, the reason why people need boosters is because these viruses get very smart and change how they're able to overcome the obstacles of the old vaccines. So this is why we create new ones. The mRNA vaccine that I was talking about earlier, it's very cool. And I really enjoyed this infographic shared by the UK Health Security Agency. Before I get into specifically what the captions are saying, I want to give a bit of analogy about how our mRNA works. Think about it that your best friend is giving you a cookbook with specific recipes as to how to make a wonderful dish. This is actually how the mRNA vaccine works. The mRNA is a set of cooking instructions that teach the body specifically how to make this amazing meal, or in this case, teach the body the specific ways to combat the vaccine. Again, it's like a set of cooking instructions to make a meal. So the vaccine is a set of instructions on how to combat the virus specifically. We have mRNA in our own bodies. If you look at the bottom left side, it is the set of instructions for how to build specific proteins in our body. mRNA is used in vaccines. It delivers the set of instructions to build protein identical to a part of the virus or the bacterium. And so instead of giving the body exposure to the virus or the bacteria, the body is already equipped with a set of instructions on how to combat the virus or bacteria. That is how the mRNA vaccine works. Once the protein is assembled, our immune system recognizes it as a foreign body and produces antibodies that will attack the protein when it encounters it again. Our body makes its own immune cells and then takes over. It's pretty neat. I put this slide up here to show you that a lot of people are getting vaccinated, and that's amazing. Our wonderful borough of Manhattan that we're on, 99% of the population has had at least one dose, and 87% of the population has completed their primary series. Primary series meaning that they've had at least 2, if not 3 vaccines. This is encouragement to show that people are getting their vaccines. We need to go a step further and just complete our booster series. People are getting vaccinated and doing their part. This is why we don't have such significant new number of cases, so many more hospitalizations, and so many more deaths compared to the past, in part because people are getting vaccinated, people are wearing masks, people are practicing appropriate hand hygiene. New year, new vaccine. Because of how smart these viruses are, the more people who get the vaccine, the less COVID will spread to others. The most at risk are folks who are less than 5 years old, greater than 65 years old, pregnant people, and those with chronic lung or heart conditions. The COVID vaccine doesn't 100% guarantee prevention. However, if you do get the vaccine against COVID, there's a much reduced risk of severe disease and hospitalization compared to if you had not, because your body, again, is building its own immune defenses against the infection. Vaccines are available at your clinician's office or your local pharmacy. The youngest age that you can get COVID vaccines, which is as young as 6 months. The number of vaccines you get depends on the vaccine type, one's age and health status, but it's not something that you all need to memorize. Your good old clinician will know, your good old pharmacist will know how many you need to get. So please ask your physician about COVID symptoms, testing, and vaccines. Also be sure to ask your neighborhood NP or PA. Any healthcare provider in the medical setting that's knowledgeable should be able to help you. Another plug to please stay up to date on all your vaccines. I've already gone over the COVID one. The flu shot for 2025 is available. The flu season is running from the beginning of October towards the end of March, early April. We are still in flu season even now. RSV, that's respiratory syncytial virus, one shot if you are over 60, and then the pneumonia vaccine. There's two categories for those. All adults greater than 65 get one dose, and if you are high risk, meaning you are pregnant, immunocompromised, either with HIV or cancer, or even have diabetes or heart disease, you get one dose between the ages of 1964, and then you would get a second dose when you're greater than 65 again. This is just another space for those who have long COVID, that there is support for you, even though there's no specific test to detect long COVID. Please note that there are resources in the community, such as long COVID clinics, programs, and community support. Please speak with your healthcare provider about following up or obtaining these resources. And unfortunately, the folks who are at most risk for long COVID are those who did not receive the COVID vaccine, or people who experienced more severe COVID illness compared to others. And again, that is linked to not getting the vaccine. And unfortunately, people who are immunocompromised, or like special populations that I was mentioning before, those are the folks who are also at risk for getting long COVID. It's still being studied why such people get these persistent symptoms, but I just really want to stress that there is opportunity and community support to help these folks out. Please come see us at Settlement Health Clinic. We're on 106th Street in between 2nd and 3rd Avenue. This is our phone number if you'd like to set up an appointment, and that's my card on the right-hand side. All my references. I don't only work in my outpatient clinic, I also see patients in the hospital and in the ICU settings, and I have unfortunately seen some patients over the past couple months been intubated because of flu and COVID still. So the flu season was very gnarly this year. And like I keep saying, it's because these viruses keep getting smarter and smarter. But please don't think that there's no hope. Human beings are extremely intelligent and resourceful. And this is why we have the vaccines to help us.